Welcome to the Anatomy of Therapy podcast. I'm Dr. John Cebulski. This is Dr. Bobby Riley, and this is the book release podcast. We're going to talk about our new book, Stretching for a Pain-Free Life. It's out now. There it is. Bobby's got a copy. Number one on the new releases because of so many pre-orders. Thank you guys to the people that pre-ordered it. Please go leave a review if you have. But we're going to talk about the book today. I think before we get into what the book is, we're going to talk about what the book is not, because there's a lot of things out there in the fitness world, like especially being kind of known through Instagram and social media the most, where people go on social media to look for like fancy exercises to fix all the problems. This book is not like super fancy exercises to fix all your problems. This book is not like trying to be a viral video. Like, Bobby and I have been doctors for over 10 years. And why don't you kind of tell them what this is not, maybe? Like, this is doctor. This is our clinical practice. I was telling somebody the other day, this is like a first album. They're like, was it hard to write this book? And I was like, no, not really. Like, I've been in practice for 10 years and there are patterns that you see in practice. I mean, I think when I left my practice, I treated over 50,000 patients, like they gave me the numbers, and you pick up patterns when you see 50,000 patients. And so this is not viral video, hacky rehab. Like, this is clinically tried and true stuff. How would you describe it, Bobby?
Yeah, 100%. It's like, we can get kind of bogged down, or we say myopic, in the sense that the interest that you have, you kind of think that everybody has the same interest as you sometimes, or you assume that everybody wants to play on, sit on the floor and work on their 90-90 position of their hip. And, we think that because we follow Andreo Spina, that everybody's like Andreo Spina, and we want to spend our mornings while we're making coffee doing hip circles and shoulder circles. And the reality is almost nobody likes to do that. Almost no person on earth.
They don't have time.
Yeah. And even the people that do it probably just got to the point where they understand how important it is that they do it anyway. So, I mean, this is my job, my career, my vocation. And half the time I'm going, I don't really want to do that. I don't really want to work on my adductors right now, but I know I need them. And only because of maybe some insight to my own issues, and because it's a little bit of a passion, that I can get myself to do it. So this book is with the understanding that not everybody has a passionate interest in body work and fitness and exercise and trying to optimize everything about their life. This is not there's not a bunch of Tim Ferrisses listening to this podcast. Buying our book is the main point here. It is meant to say, hey, we understand that you don't have infinite time. We know that you don't have infinite patience to work on these things. We know that you don't love it. We know that you need to see results soon. We know that you probably have problems, but you're not gonna take away your Netflix time to do it. So how can you fit it in, right? So it's saying, what is the least amount of work that you can do that will safely, most likely, increase your performance and your body's ability to move and to integrate with other parts of the body. So we know that it doesn't take sometimes that much work to stay healthy. We know that if you just a little bit better at, like, for example, if you're just a little more fit, your all chance mortality goes down like 50%. If you're just a little fitter than most people on earth, you tend to have great outcomes and decreased chances of mortality. And it's kind of the same thing with the body. You don't have to be this guru that just spends 2-3 hours a day stretching and working on planches and splits. It's saying, here's 5 minutes, work on this area or another area that you have a problem. And if you're really motivated, you can work on some areas that aren't even causing you problems yet.
I think that's a big thing, because this is also not for people who have like a high level of athletic experience. You do not have to be an ex-college athlete to do these stretches. Like, we're not gonna, you don't have to be flexible to do, like, this is not for people's body types who have done years of yoga. This is for the body type who has been in a profession for 10 years and raising a family for 10 years and maybe took a little time to jog around the block here and there, but like honestly really hasn't done anything for their body in years. Maybe will find these stretches and exercises, these positions accessible. Like they won't be like, I don't know, look, I haven't done anything with my body. That this book is made for you. This isn't like, I've tried this, I've tried that. Now, I also think the people that have tried a bunch of stuff might find that the things in the book are actually like foundational things that you need. Because a lot of times you go off on these rabbit holes, you know, the people that do seek these things out, and they're just kind of rehab junkies. This is a ditch on the other side of the road. And so I would say, even for these kind of rehab junkies who are like, this, hip circles, morning routine, midday routine, working on my back extension and my split squat at the same time and my deadlift, you need a foundation of movements to kind of go to. And this is kind of that foundation. So whether you're a tenured, this is like, you know, there are some people who have been running for the last decade who have been kind of, let's just call them amateur athletes, you know, they've been doing a half marathon there. Maybe they ride a bike. Like people that are, you know, more active than the average bear are still need a routine, a baseline of things that they can refer to for their hip or for their knee. So I feel like this has just a very broad range of accessibility. It's a great base for all the major joints of the body, honestly. But yeah, let's talk about the approach a little bit more. Now we're getting a little bit more nuanced. So this is for the average person and the everyday person. Like this is accessible stuff. And the chapters are kind of laid out where we explain why the stretches matter. Like, if the stretches matter, then there are consequences to not that stretch. Does that make sense? So like the stretch, the exercise is trying to push your body in a particular way, whereas the opposite might cause a problem. So the first half of the chapters, we kind of set up the area of the body. We, you know, if we're talking about the hips, we say we have a pelvis and a sacrum, and there's two femurs that hang off, and you know, we kind of give some baseline understanding of it. And then we talk about the problem. You want to kind of talk about how we go through the consequences first of that, Bobby?
Yeah. Yeah, we're saying I guess there's really two populations that I'm thinking here. Is the first population is just, I guess, kind of includes everybody. It's like the whole Venn diagram is everybody. And
Yeah.
what we're saying is that humans are humans and they have human problems. And because we're all humans, it doesn't matter if you're Sudanese or Balinese, or it doesn't matter. You're still human, and humans tend to have very predictable patterns, you know, entropies that happen to our bodies, like changes and breakdowns, and these patterns are, yeah, like I said, quite predictable. Of course, there's variety because some people are professional baseball pitchers, and other people are bricklayers, and other people are desk workers, and that will have an impact on the predictable outcomes of that person's issues down the line. But in general, it's still very uniform in what we can predict. We can predict, you know, the elbow doesn't usually wear out like before the shoulder. You know what I mean? It just doesn't. I mean, it can if you have some trauma or you're a baseball pitcher, or who knows what happened to you in gymnastics where you tore that UCL or something. But in most humans, you're not going to have elbow issues before shoulder issues. You're not going to have, you know, you're not going to really have a problem pointing your foot before you have a problem lifting your foot up towards your shin. You know, you're not going to have as much of a problem with your quad strength as you are your hamstring strength. These are just patterns. This is just what we are. We're upright, bipedal, walking on 2 feet organisms that have to breathe and have to deal with gravity a certain way. And, you know, we're heading in a direction where we don't do what we kind of have kind of evolved to do for hundreds of thousands of years. So it's becoming even more predictable, I would say, because it's less about traumatic injuries for the general population as it is just um, decay and breakdown and lack of use. And when we say lack of use, that's also a key thing here. So you say lack of use while I walk is not enough for my hip, and I mean, I use my arm, so isn't that the use of a shoulder, right? And I think we decided to attack the areas of common concern of humans by attacking the you know by being multiplanar in our approach. So I would kind of say, like, maybe John, like, how would you explain? So we basically said
Yeah, I got this.
most people are going to get these problems. This is what we did. We sifted and we said, this is what most humans have a problem with. Okay, now what's the least amount of work but most focused protective or productive work we can do? We're going to say it has to be multiplanar work. And why is that the case? And why is that protective, and why is that not so easy to do just with normal life?
Yeah, I think that's a great way to phrase the question. Because we're limited to 3 dimensions in space, because we are space-bound beings for now, okay? We are limited to space and time. These are our ultimate constraints. And space is neatly defined into 3 dimensions. You can move forward and back, and we call that the sagittal plane. And most movement occurs forwards and back in life. That's the bulk of movement, forward and back. Now, there is a little bit of left to right movement in life, and then there is also some rotational movement that happens through all 3 planes. So ultimately, a lot of exercises will, or let's say traditional exercises versus how we think of exercises. A lot of traditional exercises try to isolate a very particular muscle. And because upon testing, they will find this muscle is weak near the injured site. And if we simply strengthen up that weakened muscle near that injured site, it will strengthen up the area. It's an old way of thinking. So they will try to do anything to strengthen up that muscle. However, that muscle works through planes of motion. So your brain doesn't really isolate muscles. Your brain knows movements, not muscles. When you bend down for your toes, your body doesn't go shift weight 2 heels, engage hamstrings, inhibit hip flexors, flex spine down. Like, you just reach down for your toes. It all happens together. And so in the rehabilitation process, pain is anything that is like where your body is disconnected from those larger patterns. So like in the flexion pattern, which is all one thing, you reaching down to pick up your groceries or tie your shoes or do normal things, bending over is very important. If in that process of bending over, you feel a small part in your back, and it feels however it feels, that is a disruption in that pattern. So rather than trying to fix that part, we are trying to fix that entire pattern. We're going to try to fix that entire movement. And when we fix that entire movement, those parts start to work with the whole. And when we fix it, those whole movements move through planes of motion. So we fix movements through planes of motion rather than isolating muscles to like slowly pick apart your strength. It's a little bit more of a broader way to approach things. Does that square the knot? What did I miss there?
No, that's right. I mean, you've mentioned the word foundational twice now, and I think that's the key. So when people pick up the book and they're saying, well, this seems kind of basic. Well, it's basic, but yet you're not doing it, are you? You're probably not doing it. So it's basic in the sense that there's not a lot of implements, and you don't have to do a single leg split squat with a safety squat bar, and it's not designed to fix a particular injury like shoulder tendonitis or knee tendonitis. It's saying, which I think is great. You touched on this with your point about the foundational aspect of, we're not trying to fix that tendon. We're trying to say, why is the tendon a problem? And most likely the tendon is a problem because it's getting stressed unevenly. And that's usually because it doesn't have access to this fluid three-dimensional capacity, right? So we're saying, if you have right low back pain that came on not from any trauma, you didn't get in a car accident, they say, well, why does your right low back hurt? Most likely, something is limited in your body. A hip can't rotate. A spinal segment is, we'll call it stuck. It's not free to move. You might be slightly curved to one side, or your body likes to shift the center of mass to one side of your body more than another. It doesn't need to get any more complicated than that. We're just saying maybe your foot and knee and hip and shoulder and rib cage, they're not really free to move. They're only free to move where they can move. And because you can only move where you can move, that may not be optimal. It's kind of like the car still drives completely satisfactory with half the amount of air in one side of the tires as it does the other. You can have 15 psi in one side and 30 in the other, and your car will drive. It'll operate. You can go to the grocery store. You can go pick up your kids. You can take a road trip, but you're going to have uneven wear, and you don't feel it at first. You might feel it at the steering wheel slightly, but otherwise nothing happens until you blow a tire or something worse happens. And it's that balance, that foundation. The wheels are the foundation of the vehicle to keep everything kind of symmetric, so to speak, operating, letting you operate freely. And so if your hip, for example, cannot move, it can't rotate in, it can't rotate out, you can't swing your leg out to the side, you can't bring it forward or backwards, one of those or several of those planes are limited, well, then the impact is no longer local. We don't even know. I wouldn't even be able to tell you where you're going to have pain. It could be in your hip, could be in your low back, could be in your mid back when you go to throw that ball to your kid for the first time in 12 years, and you felt your back hurt because your upper back hurt because you had to over rotate something you don't rotate because your hip doesn't move. That's why it's actually quite complicated to treat people, but yet if you can work on foundational stuff, it kind of eliminates a lot of work that people like us have to do at a more high-end level. So we're saying and we focused on 8 key areas of the body, and those 8 areas are what we see most commonly having issues with as we age, as we stop using things, as we stop playing sports and we're doing these 3-dimensional movements. And if 1 or 2 or 3 or all of them are no longer really optimal, I'm going to start betting at the casino or in Vegas that you're going to have problems. I'm not going to bet where. I'm just going to bet that you're going to have problems. Is that fair?
I think the converse of where those problems are what. So the gamble that we have to make, seeing as many patients as we've seen, and honestly, just being aware that there are that many people looking at your stretches and exercises online. I'll just be honest. It changes the way you think when you make a video online and 1 million people see it. Sometimes more than 1 million people see a stretch that you do. And then the next stretch that you do, you need to think about what stretch or exercise are you going to give for what problem that will help 100,000 people, 500,000 people, 50,000 people. When does your brain have to think like that? So we poo-poo social media, but it does force you to think about how to help people that you're not going to see. And you have to put your flag down and you have to say, most likely you cannot extend your hip backwards, and you need to learn how to extend your hip backwards. Otherwise, you will continue to overextend in your spine. This is a very common pattern where people are unable to move their hip behind their center of gravity. And instead of moving their hip behind their center of gravity, they overextend their back. And the back is a small set of muscles. It's a small set of joints. There's just 5 little segments, little pillars stacked on top of each other. They've got muscles on the side. There's a lot of soft tissue that does support the low back, but it is generally much smaller and does not bear and should not bear as much load as the hip should, specifically your pelvis and your femur as it moves behind your body. And if that doesn't happen, you will hurt in your back. And so, that's such a common pattern that if 50,000 people are going to be like, hey, what should I do for my back? I would be like, everybody's got their own story. The zebra stripes of the Sahara are different. No leopard spots are the same. And you're the same as well. I fully believe that. However, our body is limited to 3 planes of motion, and there are common patterns where small muscles do too much work, big muscles, joints don't do the work. This is actually the father of orthopedics said this. So this is actually pretty sound clinical advice. He's like, if you have pain, you always need to examine the patient's joints above and below the area of pain. So what we did is reverse that cycle and said, okay, if there is pain, we're going to make good below and above. Does that make sense? So he's saying there's probably pain in that area because of a joint above or below. You at least have to check to see if there are limitations in the joint above or below. So if there are not, if the joints above and below feel good and move as they should, then the area in between those two joints benefits. And so this is why you can do our chapters like the shoulder rotation or the spinal chapter that Bobby wrote. You can do it if you don't necessarily have, say, spinal pain. Say you've got shoulder pain, you've got knee pain, and you do the spinal and thoracic side exercises, and you make your spine move, but it doesn't move bad. You don't really have problems in your torso, but you do this chapter on thoracic rotation, the progression. You do Bobby's chapter on the spinal wave, learning how to control your spine, and you develop these skills even though you don't need them, and your knee pain gets better. Like specifically people who have pain on one knee or one foot usually means when they're shifting their weight left to right, that side of the pain, there's just a shifting left and right that's uneven. Like back to Bobby's tire analogy, right? So even if you were to correct your thoracic spine and make your spine move in a very functional and smooth way, you would be able to shift your weight more evenly left to right, and that possibly could balance out the pressure in your feet and your knees. I've seen it happen many, many times. So, even if you don't have a direct problem, like this book will be good to go through. And I would say the next thing is people that do have problems are probably scared. They're like, look, I have arthritis and my doctor said I have degenerative disc disease. Should I do this book? What are some diagnoses that you would say are safe for this book? Because there are people who have the doctor's like, you've got a herniated disc. Should they do the book?
The nice thing is that there are some caveats or some warnings, and they're in the book and they are highlighted. So for example, there's in the spinal section, there are some, recommendations. So if you do this and your symptoms worsen or your sciatica increases, just stop and, contact a professional, local professional, doctor, PT, chiro, whatever seems to suit your situation. And yeah, it'll let you know. So there are times where, I've had patients come to me and they say, my hip hurts a lot. And I check it and I say, man, this is, sorry to tell you, this is close to hip replacement time. Let's try some stuff and see what happens. And I remember somebody in the Netherlands in particular with this story. And they just came back and it's just like, well, now I'm worse. And I'm sore for 2 days after it. And I didn't give them the splits. I gave them some super basic stuff. And there's zero tolerance for it. So if you cannot tolerate it, the first step is just, back off and try again later, like let it recover, or try to ease into a different position very gently, or, don't do it so aggressively. Like we have a shoulder one where you have to like pin your arm down and roll and stretch it. That can bother some people. So you have to kind of change where your arm position is. Maybe don't roll all the way. But at the end of the day, sometimes the joint has an orthopedic issue, which means it just doesn't have the capacity anymore. And if that's the case, yeah, you're going to pay for it. It's going to seem like everything that we're telling you to do is just has a consequence, a negative consequence of another a day or two of worsening symptoms. That's a time to go in. If it's if anything gives you pain during, after, or the next morning, I would say to question if you should do it. Doesn't mean you can't, but it means you should question it. And that just goes for everything. But most of the book is written with, and the exercises were chosen that they are self-limiting in the sense that you have some control over the degree at which you do it. So some exercises, you just can't do a certain thing without doing it all the way. Like if we say a deep squat, well, you just have to deep squat and that's it. But with everything, there's just a degree to where you can stop. So some people, if you're doing a groin stretch, well, if you have a terrible flexibility in your groin, you're just not going to go very far, and that's where you are. And if you have great flexibility, the leg is much wider and you sink way deeper. But if you can't, if you can't tolerate it even in the beginning, then it's a sign. It's a sign for one that things are really not doing good. You're not in a good place, because these are foundational movements. They are self-limiting in the sense that you can choose how deep to go into them. None of them demand any kind of abnormal or super flexible capacities. You don't have to be an athlete, like John mentioned. So I think just I would want to close in, or have you come back into this to talk like more specifically exactly who it's for, because I think when we did this, we said, well, well, I'll ask you this: is this book for people that are in pain, or is this people who are not in pain but want to avoid the future? They want to have a future of picking up their kids. They don't want to have shoulder pain. Or is this for the person that has shoulder pain?
I think it is actually somewhere in between. I'm just going to answer controversially. And, most people have pain. The number one reason people have pain is because of a previous injury. And it's not to say that previous injury is where the pain will be, but that previous injury can have a ripple effect of causing pain elsewhere. And that's what we call chronic pain in our world of chiropractic and physical therapy and physiotherapy, musculoskeletal world, is that most people kind of a long time ago had a little thing that happened and it was a bummer for a couple of days. It hurt their back for a couple of days, or they tweaked their knee, or they sprained their ankle, or it wasn't a big deal, but like we lifted too much and you tweaked your shoulder. And for a couple of days, it was a bummer. It was tight. And then it kind of went away. And then a couple years later, you notice your elbow on that same side start to just like act funny, or the neck it happens a lot with the neck. The neck is a constant. You're like, where did that neck thing? Did I just sleep weird? That's what, and so people blame because they just wake up one day. Or same thing with the back. You're just like, I wasn't doing anything. And then my knee started to hurt. My heel just started hurting one day out of nowhere. And it seems like it's out of nowhere, but there is usually an old injury that's not really bad anymore. Like, yeah, you did hurt your shoulder at one time, but honestly, you could do everything you need to with your shoulder. It's a little sticky when you're like putting your bag in the airplane overhead, but it's honestly, it's fine. It's not worth seeing the doctor for. That old injury that's not 100% has that ripple effect through the body. And the older early on from those injuries, the ripple effect is really far away from each other. In other words, it might be years before you start to see that old injury creep up in another way. But as you get older, and we've seen this because we've had patients that come back to see us year after year, that those ripples are less and less closer. So say you hurt your back and then it comes back in 3 years. The next ripple effect usually is like a year and a half. Then it's like 9 months. Then it's like every 6 months. That like I throw my back out every 6 months. I throw my back out every year. Now it's every 9 months. Now it's like it starts to get a little bit closer as you get older. Now, maybe if you're younger, you don't really see this pattern of pain yet. But being a practicing clinician, you see these year over year patterns that get shorter and shorter. And sometimes if people are aware enough, they're like, oh, dude, I know my back is fine right now, but it's coming. Like this fall, I know this Christmas, we're going to travel to see my family and I'm going to sleep in this weird bed and my back's going to hurt. I promise you. There are people that know that. They're just in that cycle of the pain where it's just like, here it comes. This is for those people. You may not be hurting right now. It's not, you didn't fly across the country. You know, you didn't have your yearly trip to China or whatever back to the East Coast, but you know it's coming. This is for those people. These are the foundations you should work on and get ahead of before that thing comes back again. That's the chronic pain world.
I would add to that too, that maybe it's not pain, but it's your ability to tolerate things. You know what I mean? Like, so they say like, well, I used to be able to run.
Yeah.
Or I mean, 10 years ago, I could kick that soccer ball really hard, but now I have to hit it with the front of my foot, like Jack Dempsey, cause I can't plant and rotate and kick it soccer style anymore.
Right.
I could, I can't imagine playing pickup basketball now, but a few years ago I could.
Yeah.
That's because, I mean, I can give you a really quick anecdote of John's story, just of my own, is I pulled my right groin a couple times fairly close together at the end of my track and field career, throwing the discus. And it healed and I was fine. And I'm good because I did CrossFit and I still played some pickup sports and intramural soccer. And I just kept playing. I'm still very active. But then, I had that stretch where I hurt my back, and I had stretches where fitness is not my primary goal, or I stopped playing pickup, a lot of dynamic sports, more like just I'm in the gym weightlifting. I'm getting biceps, which is great, but it doesn't do anything for your like dynamic ability, so to speak. So now, I have limited ability to access the right groin. Like it always feels more restricted. It feels like it's holding my right femur closer to my pubic bone. And so all sorts of things that people don't understand come in to this situation. Do you think I have as much power on my right glute as I did before I had a restriction of my right groin? Well, no, I can't use my right glute because I can't pull my leg away from my body as well as I used to. So I have my power and my ability, like it can fire, but it just can't pull my femur anymore. You got another guy on the other side tugging. So if I do something like pick up basketball or soccer and I try to play really hard, I'm probably not going to injure it. Although I would be a little sketchy of full sprinting right now, to be honest with you. But I imagine I'll wake up tomorrow with a sore right groin. And that we've talked about this in old podcasts of like being very aware of your body whispering to you. So if you do something like that's very bilateral, like a squat, and you wake up and just one glute is super sore and the other one's not sore at all, you're not injured, there's no pain, but you're getting these blinking lights and a warning sign saying like this is not normal. If your Formula One car comes into the pit and just one tire is just destroyed and the other one's fine, you got some problems with the setup of the car. And that's the kind of the same thing, is these asymmetrical sorenesses, these asymmetrical pains. You go for a run, which is a totally bilateral movement, but you wake up and one calf is sore or one knee is sore, or like people get the low back hurts all the time after a long run. Like my left low back hurts. So I would say, this is for people who are trying to, like you alluded to this with the back thing. They're trying to counter the past. They're trying to retain access to what their body can do. Yeah, I think it's really sad when you're 32 or you're 29 and you have this massive fear of playing tennis. Like I don't want to like move sideways and reach for that ball. I'm definitely going to pull something. You know what I mean?
Yeah.
So And we say this in the book. It's like, first, just restore some ability to these key areas. Then go ahead. And this is John's chapter at the end. Then go ahead and load it. And I don't mean load it by weights. That's one option. But you can load it with jumps or plyometrics or tennis or gymnastics or marathon running or whatever it is that actually gives you joy. But preface that passion, the thing that you really enjoy doing. Let's be honest, not many people besides John like to just do hip rotations for fun, and just loves it. I'm in the camp with you guys that are like, I'm doing this because I should. I don't really want to do it, but do it, because then it gives you access to the thing you actually do care about, which is picking up your kid or playing beer league softball without tearing your Achilles running to first base.
Yeah, I think I want to go back to something you said about how your body whispers to you, because I think that that people, if they could kind of tap into that, it would help a lot. And I think that's also one of the things that our stretches are moving towards. So like the stretches in the book are always moving away from something, but they're also moving towards something else, right? So we want to move away from these painful patterns that we fall into, but like, what is it we're moving towards, and how are we moving towards that? So the book sets up at the problem, and then it's like, all right, if that is the problem, then let's move towards this sort of solution here. And so like when Bobby says your body whispers to you, you were at the theme park with the family over the weekend, and you were just on your feet for 8 hours. You're never really on your feet for 8 hours like that, and so the next day your dogs are barking. You go on vacation and you walk around London, New York City for a day, and your feet are talking to you. They just did not take that much stress. And so your body will tell you a quality that your body has. Like, your body cannot bear that much load. Now, your body cannot bear that much load in your left knee when you walk around New York City all day. Why? So one of the goals, the things we're moving towards, is to teach your body how to bear load more evenly. So a lot of the stretches are trying to place strain on areas that don't often have strain put on them because it's overstrained in other places. Like I talked about the low back. Like, so the low back is often overstrained. You stand too long, you sit too long, you lay in a bad spot, you get up, oh, my back has too much strain on it. And maybe the strain remains there for a little bit, you move around, it kind of feels better. The idea is that rather than putting strain on the low back, you need to learn how to put strain in the front of your hips. Generally speaking, the front of your hips, some people would call it like the hip flexors, but some people more sense the quadriceps or even the lower abs or maybe the groin. But we're talking about sensing pressure in the front of your body, learning to sense pressure there, because you just don't most of the time, but you always sense pressure in your back. To some degree, there's a little pressure in your back, or there's an unbearable amount of pressure that's got you crippled and like on the floor. So that's the thing we want to avoid. In order to avoid overstraining the back, a technique is to learn how to strain the front of the hips. The front of your hips can tolerate more load and strain, can carry that weight better than your spine can. And you need to teach your body how to carry the weight through the hip flexor and the quads, these big muscles in the front of your thighs. You need to tell your body to learn that. Otherwise, you will continue to fall into your learned pattern of moving through the back. So we move away from overstraining the back, and you're teaching, these stretches are whispering to your body, hey, put more strain in the front of the thighs. Your quads can be very helpful here. Or, hey, it's better to stretch. We have a pigeon stretch, where like my version of the pigeon stretch, that is. And you're learning to load deep into your glute. You're learning to load a hip capsule. That's kind of the separation between your hamstring. You don't usually load that area, but if you learn to load that area, you will offload common areas of strain like in your low back. And so that's what we're moving towards. We're moving towards teaching your body something new by just kind of exposing it to strain, really, because that's how your body learns in the first place with pain. When your body experiences pain, it tenses up in a unpredictable way. There's studies that say movement is inerrant when pain occurs. So like, you touch your finger on something hot, your body kind of reacts, but we don't know exactly how your body reacts. We know it jumps and to protect itself, but we don't know how you specifically jump to protect. We know you protect yourself.
Mm-hmm.
We know that there's survival, but at what point, how do you get out of that survival mode and into more like rebuild mode? Maybe you can speak to that a little bit.
I think you just have to have the freedom to be able, like, you can't put your arm where you have no freedom to move it. So let's say you touch the hot stove. This is a ridiculous, case, because almost everybody can pull their hand back. But if you were so locked up that you couldn't pull your hand away, there's no safe way to pull your hand off. Like, you're stuck there. Or the only way you can move it is sliding it sideways along, the stove that's still hot. Like, you just don't have any freedom to move it wherever you want. Like, maybe there's this is ridiculous. Maybe there's knives everywhere around the hot stove except for one angle where you can pull your hand out. But if you don't have access to that angle, well, now you just impaled your hand on a spike. Like, and that's the base level point of the book, is to say, hey, just don't forget that the hip doesn't just go from a seated position to a standing position. It doesn't just go from 0 degrees of extension to 10 degrees of flexion when we walk, 30. It does other things. It turns. It's a ball. It's supposed to rotate. Your leg should be able to go out to its side. It should be able to go behind you. It should be able to turn in and turn out. And we're kind of just saying, like, hey, wake up. Like, don't forget that you have these other things. And you don't need to be Cirque du Soleil person who has to maintain these incredible ranges always to do your job. We're just saying, if you do it a little bit, if you just move it a little bit, it keeps it from just becoming solidified. It keeps it from cementing. And when it does cement, that's called an orthopedic condition. That means you need somebody to saw your bone. You need somebody to go in there and shave off the tip of your acromion so that you don't get shoulder impingement anymore. But most people, that's not their reason. Their reason is they're just limited in their ability to freely move, and that pinches things and pulls on things and pulls on them obliquely, so the stress is not able to be tolerated very well, and we get injury. So we're just saying, like, hey, areas of the body that usually have a problem, let's just keep you moving, and let's maintain that freedom to protect yourself, as opposed to only having one movement strategy that you don't know if it's good or bad for you. You don't know if it's leading to decay or not. But that's it in a nutshell right there. And that's why I think, to answer my own question, I think it's for everybody. I don't think it's for, like, trauma. It's not for, like, if you tore your UCL because of a trauma, or you tore something. It could be, but I mean, and that's down the road. I mean, this book is not for you if you just tore your Achilles. You got to repair it, and you got to do all of the PT exercises, and then down the road, way down the road, you can maybe ask the question of, why did I tear my right Achilles, not my left? But right now, just, that's not for you. But I think it is for everybody. For, like, if you just have chronic low back pain, or you're somebody who just says, I don't want low back pain, I don't have any, I don't want it. I think it's for both, because it's such a foundational book. It's saying, keep this stuff healthy, and you're probably going to stay healthy. Or it's going to say your chronic non-traumatic low back pain is most likely a product of the fact that you don't have freedom, and you don't have sometimes freedom and strength to move in the way that your body needs to. And therefore, it can clear up a lot of issues on its own.
For sure. I mean, I think one of the fun, interesting things about this book is that the stretches and exercises are fixing these hidden patterns in your body, like, and helping you make connections about your own body. Now, like the chapter does try to explain the pattern that the stretches are trying to fix. So it's not that hidden, but I would say there are certain people that understand by reading. Like you could just read it and you get it. And there are some people like me who have to do it to understand. Like I won't give you a stretch exercise I've not done myself. I've not experienced myself. I've not understood what it's doing. That's how I understand the body, is by doing all of these stretches myself and seeing that they're useful and trying them out on other people. And so, they're fixing basically what we think are these hidden patterns in your body. So like you're like, I've probably got hidden patterns. I don't know what they are. These stretches, by doing these stretches, you will make connections of those patterns. Like you'll realize the patterns within your body by doing these stretches. You'll be like, oh, I see how that's like. Some people, I understand, like we're trying to help you understand this book as best as possible before you buy it. But there are some people who just have to do the exercise and then you'll get it. And those are also the people who are going to get the longest lasting results. Like the people, and look, you can do these exercises 5 minutes a day for a month and you'll feel better. Don't put any more thought into it than literally just show up. To an extent, we've done podcasts about this. Your body is a set of mathematically precise processes. Like that really will run, and it is kind of boring. And if you show up and you do stretches every day, your body will change. Just a fact, it will. If you show up and you put in the time under tension, changes will take place. Same thing as working out. Working out and getting strong is boring. If you want to get strong, lift more weights, more, and you will begin to get stronger. Stay consistent. If you want to get loose and free and have your body well balanced, do stretches. Spend a little time. You don't have to think about the theory of it. Just open up the book, do what the book says, do a set a day, 3 times a week, walk away, and just live your life. But there are also people who want to know what's going on in their body. Like there's a certain type of patient who's like, explain it to me. Please help me understand this. I don't know what's going on within me, and I'd like to. And that's a legitimate patient. And I think doing these stretches and exercises through the sequence that we set them up, like we said, step 1, do this, step 2, do this. So sometimes you'll see some of the pictures and you're like, oh, I've seen that stretch before. Okay, fine. But the way that we set the stretch up, the sequence with which we have you put your body into positions, allows you to sense things and put pressure on certain areas of the body because of the sequence. And so by going through the various steps of these stretches that we tell you to, you will have to experience your body in a certain way. When you do that, you'll understand by feeling. And that's just how some people really learn. Like I played sports and someone was like, hey, this is how you shoot a free throw. You have to say goodbye to the ball. You're like, what do you mean you have to say goodbye to the ball? And then you get a ball in your hand and you shoot and okay, I understand what you mean by doing it. So those are the other 2 people. If you really want to understand your body, you will understand a lot about your body working yourself through these chapters. If that's something you're interested in, you will understand the mechanics of your body on another level. You'll understand the way we see the body. If you want to take 20 years of clinical practice into stretches and just kind of download it into your body, then go get this book and learn how we think the body should work. Ideally, you'll learn a lot. Or just show up and do the stretches every day and your body will change. Either way you win. Either way you win. The book is available now. We released it #1. We're really excited about it. We're really thankful for all the people that already have bought it. We really appreciate you guys buying. If you have bought it, it's a very big deal if you go do a review on Amazon of the book. But we would very much appreciate a review on Amazon. Be honest. But we really appreciate your reviews on Amazon. We'll have links to that below here. Any final words, Bobby?
No, that's good. I would say thank you, and I really mean it. I appreciate it. People who get the book or who have supported us in any capacity. I think it's really amazing. It's a little humbling. It's kind of weird seeing your yourself in a book, but it's also cool. And yeah, I just think it's a tough. It's hard to write something for everyone because there is no such thing. That's why there's all these different practitioners that do different things, and there's adjusting and there's exercises and crystals and people who do Bosu balls and bands, and I mean all of the stuff works. It just depends who's the receiver of who receives it. You know what I mean? Yeah. And I think we just did an honest effort at just saying, the basics are really. I mean, every sport will tell you this. Just get the basics of your forehand. Just work forehands for I don't know, 500,000 shots. Federer will probably tell you to do that before you learn how to do some special move on the court, or to do a between the legs return at the baseline. He's no, just work your forehand forever and ever and ever. And I think that's what we're trying to say here is just, when the ball is hiked, the lineman has a certain cadence with his feet and to set himself and to step back for a pass, and that footwork is well beyond their combine numbers and how much they can bench press. That stuff is irrelevant without the foundations of how to do that position in football. It's completely irrelevant. That's why a lot of coaches, they don't even really care about. I mean, Tom Brady, what is he? Have the worst combine numbers in history of football. I mean, he's the slowest quarterback I've ever seen. But it doesn't matter. He's also the greatest quarterback that's ever played the game because of foundations. I mean, how can the most unathletic person be the greatest quarterback ever? And I say that with a caveat on athletic, but you know what I mean. He's not Michael Vick, but he's a better quarterback. So I think we just did an honest attempt at saying, hey, don't forget about the basics, and the basics are what everything else is built upon. So I say it's the foundation for your real passion, whatever that may be. Holding the saxophone for an hour in a certain position at a jazz bar. So whatever it is whatever you do, it's just a foundational idea.
Yeah, I couldn't agree more. We really hope this helps as many people as possible. Thank y'all so much for watching. If you have more questions, shoot us a DM or comment below and all that. Thank you. Go buy the book. We'll talk to you soon.
See ya.